The Ohio Board of Pharmacy reports that in 2024, 224 Ohio pharmacies closed their doors, leaving some Ohioans struggling for places to access life-saving medications. But this morning, Akron Children's Beeghly campus held a ribbon-cutting ceremony for their new pharmacy, opening the doors to people all across the valley. Director of Pharmacy for Akron Children's, Kyle Finnerty, joins me now to talk about the new space. Hi, Kyle.
How's it going?
Good. So can you talk about what the needs you were seeing in the valley that drove the opening of this pharmacy?
Absolutely. So from our perspective, we were seeing a need for accessible and coordinated healthcare services for our patients specifically, a place that was accessible for our patients to be able to get medications and tackle some of the challenges that are really facing our families, like transportation, medication, cost, as well as limited pharmacy access, which are really we were seeing leading to delays in care, and even in some cases, patients never receiving care because of those access barriers. And so, by opening this pharmacy, we really placed a pharmacy at the center of where care is delivered. Oftentimes now, making sure that our families can leave with care in hand, with medications in hand, to eliminate many of those barriers that we were seeing before. It's also now serving as a resource for our community members, which we find is an added benefit as we continue to move forward.
Yeah, for parents, seeing your child sick or struggle is obviously one of the most difficult things to deal with. How does the pharmacy being right there at the hospital help relieve parents of maybe some of that stress?
Right. When a child is sick, the parents are focused on making sure that their child gets better as quickly as possible. And so one of the worst things that we can see is that families have to go to multiple pharmacies on their way home with a sick child to be able to find the medication that they really need to get better and feel like a child again. And so being able to have a pharmacy right here at the hospital allows our families to be able to connect with a pharmacist, be counseled on their medication, ensure they understand what's the proper way to take it, what are the side effects, and make sure that, again, those barriers are completely obliterated before the patient goes home, to ensure that the family can really just focus on taking care of their loved ones when they leave our hospital.
And speaking of eliminating barriers, the pharmacy is not only open to patients, but the entire community. Talk about the decision that was made to be able to serve all of the Mahoning Valley.
Sure, absolutely. I think, from the beginning, our vision has always been bigger than just the patients that we serve, but ensuring that we recognize the broader need for community access. And as we see pharmacies closing across the valley, we saw it as a unique opportunity to continue to expand access, not just, again, for those patients that we serve directly, but those patients and community members that are really looking for access close to where they live. And so we saw this as a huge opportunity to tackle many of those barriers, those complex therapies, not just for children, but for those community members at large who, again, are just looking for access to life-saving medications to continue to be healthy.
Now, this is the second outpatient pharmacy at an Akron Children's Hospital. What have you learned that you will bring with you to this new branch?
Absolutely. And I think we'll stay in the same vein. What we've really learned is taking the time to understand how important convenience and access is to our families. When medications are available before a patient leaves a hospital or clinic, like we talked about, it reduces the delays in care for that patient, and it makes sure that they have the resources that they need to go home and have access to that care long term. We also really learned, I think, the value of collaboration between our pharmacists, our providers, our nurses, and our care teams, ensuring that communication is key as we look to optimize and continue to focus on efficiency as we move forward with this new opening.
Well, being sick is stressful enough. Nice to know that there's one more thing parents here don't have to worry about. Kyle Finnerty with Akron Children's, Director of Pharmacy, we appreciate the time.